I'd like to show you the slides that are here. And it's a journey that I started in the 60s. It was a daily satellite delivered television service providing programming for hospital-based health professionals and patients. The problem I had was putting a dish down. Those big 3-meter dishes at a hospital cost us $10,000. We did get some smart people to tell us that education into the hospitals could be paid for by the government. Continuing education was important, but we wanted to bring continuing education to everyone in a hospital, as well as doctors who could come into a hospital and see a large screen. So that was a beginning, and to move along, this was the iPhone. This is what it looked like. And I went to the manufacturer and the person who was running the company and said, I love it. You have a symbol for $1, which would represent banking. You have a symbol for an airplane, which would represent travel. I would like a caduceus, because a lot of people recognize it, and if it's there and it's touched, it goes to the internet. And then amazing things happen, because a sister who once wrote an article for Wired magazine said that this remarkable priest a long, long time ago thought that there is a web, a knowledgeable web encircling the earth. His name was Teilhard de Chardin. The interesting thing about him is he lived a long time ago, died in the 50s. I think I once walked along Fifth Avenue when I was there, and I saw a gentleman. I was certain it was him, but I let my fantasy carry me forward, and I didn't stop him and ask if he was Father Teilhard de Chardin. What he had in mind is connecting anyone, anywhere. And I'm here to suggest to you that my takeaway to all of you is you can meet together every day if you wish. It's called Zoom.us. You can meet once a week. No one has to do the things that are going to affect the travel industry, the hotel industry. So there's going to be a lot of resistance, except when this gentleman started something called Zoom.us. He already had been the chief engineer for WebEx. He then was acquired by Cisco, the people who shelved my iPhone in the 90s because the iPhone cost more than a computer. And I was disappointed, but I hadn't manufactured the iPhone. What did happen is Steve Jobs met quietly and said, I need that name. I got so many other eyes, I need that name. And behind closed doors, Cisco and Apple came to an agreement, and Apple, for an undisclosed amount of money, had the iPhone. And with an iPhone or an iPad or a computer, just like Dick Tracy once suggested by looking at his watch, this whole concept of mobility, and I enjoy mobility by swimming in the morning, coming home, having breakfast, sitting in front of my computer and touching a button, and then something miraculously happens. Look at cost, and look at the 80s and the 90s and now. Look at complexity, and it's red. Do a similar observation to the to the graphic, but look at green. Green is all about coverage, and without leaving your home or office, you can work with this remarkable company that has soon to be a clear course of how it's going to do things. I would just recommend that my success in not getting my dear friends who created a satellite dish down at Betty Ford and brought a lot of content through the satellite to hospitals in America, and a number of organizations asked if they could rent our network, and we were happy to supply it. So now it's easier. And the reason it's easier, and the next slide, which I will touch in return, but I don't want to touch anything because you put it all together. So here's the good news. The good news is
Zoom is easier to use than PowerPoint.
a colleague who you just met, Skip Rodenbush, who is in Arizona, and has asked that this be looked at. So he put Mark's slide up just so we could be relevant to all of you. We put a picture of a nice young navigator or nurse practitioner or whatever it is you want to call her. And may I touch it? Or would you touch it? And you can wave to Skip outside of Phoenix. And he knew what was on the slides. And so Skip, other than saying hello and waving, what is it that you would like me to do other than have you speak to the group?
Well, can you hear me okay?
Very well.
Okay. So far you've shown two-way video. I'm going to show how you can also use this to show content. And I think it's very appropriate we just take a moment and look at an example of what I'm talking about.
You can apologize for anything, Skip, but we can't hear it. We know that Mark is looking at something. I can narrate.
That's okay. The audio comes along with the video, but I don't want to disrupt the flow of things there. But any content, medical records, videos, animations can be seen, viewed from the host's computer, and that can aid greatly in explaining. So that's all I had to say. Hopefully we can have some questions later on this afternoon.
Thank you so much, Skip. And the questions I'd like you to have is, if you have anything to teach anyone in the world, then put it together. But instead of doing it in hours or days or weeks or months, do it in 5 minutes. 1 point at a time. Mark.
Can you just, like, two quick ones, like the system in HIPAA, and then the possibility for group treatment or even meetings with 20 or more people?
Let me remind everybody that this all started 120 years ago with the telephone. Can you hear me? Now this is just about, can you hear and see me now? Okay? So everything about security, and the government has some apologies to make to a lot of us, anything about security is covered by those of you who need security. Patients don't need security. They just have to understand who the doctor is, who the nurse is, who the social worker is, who's helping me so that I can trust them. And maybe if I met them once or spent 30 days or 90 days with them, maybe I really do trust them. So why are you sending me back into something I came from which didn't work, without letting me be connected with you every day that I need to be connected with you and have something to teach me or respond to the question I have now that I'm back in my strange circle of friends and family? Any question for Skip? Because this is the presentation, and I'd like all of you to consider downloading zoom.us, not .com. Zoom.us when you have a moment. It'll go down to your iPad. Some of you can do it now. It'll go down to the iPhone. It can be on your computer. Your staff can learn to use it. And a lot of patients, and as I grow older, I don't want to get on a plane or in a car to go to UCLA, which is just down the hill to me. And I've been trying to get UCLA to let me talk to students. Medical students, for 99 cents a month, can create their own friends and do all the things that this remarkable technology can do. You can show video to somebody who's watching. The DEA picture could go into any physician's office who has downloaded Zoom for nothing. All you need is one $10 a month opportunity for you, Mark, to reach anyone in the world who has Zoom. You can have up to 45 people. I suggest you have 5 people who want to learn something from you right now, and then you can have 1,000 other people watching it, or it can appear on YouTube tomorrow. It's a game changer, truly. And nobody knows about all the things you all know about.